Ascent Audio, a division of Recorded Books, presents The Company That Solved Healthcare: How Serigraph dramatically reduced skyrocketing costs while providing better care, and how every company can do the same. By John Torinus, Jr., narrated by Stephen Bowlby. Introduction. Real reform of healthcare still to come. The top-down reforms of healthcare that barely made it through Congress will have little impact on my company. The major thrust of the Democrat-driven legislation was to improve access for the uninsured. Their concoction was mostly about who's covered and who pays. In one dimension, the national reforms are a form of wealth redistribution from the well-off to those in need. In stark contrast, the major issue for businesses at the ground level has been the costs that have relentlessly escalated for decades. That pattern of doubling of costs every 8 years justifies the term hyperinflation. It continued into 2010 with premium increases for businesses of at least 10% and often more than 20%. So the challenge for private payers has been to get some kind of grip on out-of-control healthcare charges. Congress and President Obama paid scant attention to the cost side of the equation. Worse, most of the insurance reforms, such as eliminating pre-existing conditions and barring lifetime caps on coverage, will serve to raise premiums in insured plans. This book is a story about the development of a business model that brings sanity back to the economic side of medicine. It is a roadmap for private payers. Further, the lessons learned in the private sector contain answers for insolvent public programs like Medicare and Medicaid. Politics in America has become so polarized and so bought and paid for by entrenched interests that meaningful congressional reform of the public sector's health programs has proved near impossible. But large-scale change often starts small. Remember welfare reform? It started in 2 counties in Wisconsin and then spread across the nation and to other parts of the industrialized world. Grassroots reforms can catch fire and prove more powerful than mandates from the mountaintop. That is because ground-level concepts and experiments are put to the test of reality. Do they work, or don't they? This book is about the innovations that have worked. The collection of these initiatives adds up to a new business model for the delivery and purchase of health care in America. These ideas come none too soon.
Sample complete. Ready to continue?